Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
For some people, the worst part of being in the hospital isn't the illness or operation that prompted their stay. It's the infection they got during their stay. Every day, people get infections when they're being treated for something else. And infections are in all healthcare settings, not just in hospitals. So what can you do to stay safe when you or a loved one seeking medical care? Find out. I'm Lisa Sather, your host. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. My first guest is Sue Callentine, an infection preventionist with St. Peter's Hospital. Sue's here to talk about healthcare-associated infections and how to protect yourself. Hi, Sue. Welcome.
Good morning. Thank you.
Good morning. So, Sue, tell us a little bit about what healthcare-associated infections are.
Those are infections that people get when they come into a healthcare setting for a different condition. Germs are spread from patient to patients, from unclean hands of healthcare providers, from equipment, misused equipment, and other types of devices that aren't cared for properly. Germs can be spread throughout the hospitals in a lot of different ways. Hepatitis B and C are examples of those in non-healthcare settings from nursing homes and dialysis centers. In the hospitals, bacteria, fungi, and viruses are pathogens that can cause infections. So if somebody's in the hospital, that patient can get that infection from surgeries during surgery, from injection sites, from healthcare areas that aren't clean and disinfected appropriately, and from misuse of antibiotics.
I see. So that's good information. What are some of the common types of infections people might encounter, if they're in a healthcare setting?
Boy, there's a whole list of them. Catheter-associated urinary tract infections, or CAUTI. Central line-associated bloodstream infections, or what we call CLABSI. Pneumonia, sepsis. Sorry.
Good.
Clostridium difficile from antibiotics, and methicillin-resistant Staphylococcus aureus, or what we call MRSA.
I see. So those are good terminology for folks to be aware of when they, go into a hospital situation. So are there some things that patients or caregivers can do to help keep themselves safe when they go into the hospital? If you end up in the hospital with some type of a surgery you're going to be undertaking or for some other reason, what are some things that people can do in order to keep themselves safe or advocate for their loved one who might be in the hospital to stay safe?
Sure, there's a lot of different things anybody can do. CDC is a great website that has a lot of different information for everybody. And don't be afraid if a healthcare provider comes in and is going to be touching you, don't be afraid to ask them to wash their hands. Make sure you're washing your hands. Your visitors are washing their hands. If you're having surgery, ask ahead of time if there's anything that you can do to reduce that risk. If you have a catheter, ask every day if that can come out. That's an opportunity, a way for you to get an infection. Ask if tests are being done to make sure that you're on the right antibiotic. Most importantly, know the signs of infection. Pain, drainage, swelling at a catheter site, an IV catheter site, or your surgical site. If you're having surgery, make sure that that surgeon comes in and marks that site so that you know you're getting the right site taken care of. Antibiotics before surgery help reduce infections. If you're not getting an antibiotic, ask why you're not getting an antibiotic. Blanket warmers help reduce, or warm blankets help reduce infections during surgery and after surgery. And be proactive. Have that advocate that you talked about, or be an advocate for someone. Be proactive and bring in antimicrobial wipes. Wipe down the call light, the side rails, the TV remote. All of that will help reduce the signs or the possibility of somebody catching an infection. And every medical professional that comes into your room should introduce themselves and tell them what they're there for. If they don't, ask them. Be an advocate for somebody or somebody else. If you're the patient or you're an advocate for that patient, know that the leading cause of hospital injuries right now are falls. So if you've had a history of falling, if you're unstable on your feet, if the person that you're there with has those same issues, make sure those healthcare personnel know that so they can do an assessment, and while you're in the hospital, keep you safe or your loved ones safe during that time.
That's really good information. There's so many things you mentioned that I think so many of our viewers wouldn't even have thought of before you brought those things up. So thank you for that.
Sure.
We do have a little bit of time left, so maybe just in a minute or so, if you could tell us what's going on at St. Pete's Hospital with respect to the flu that's been circulating pretty widely lately. And that is, of course,
Yes.
something you can be exposed to while you're in the hospital.
Absolutely, and thank goodness, at least for now, we're on the downside of that.
Good.
About a month ago, it was high in the community as well as in our facility, and we ended up having to institute visitor restrictions. But I'm happy to report this last month now, or this last week, the numbers are coming down. Actually this Monday, we took away the visitor restrictions. Now there's not any anymore. We have maybe 2-3 patients at a time in the hospital are only testing for flu once or twice within our hospital and our clinics, once or twice a day versus 30, 40, 50 times a day. So the good news is, hopefully anyway, it's on its way out.
That's great news. Well, I'm so happy to hear that St. Pete's is on top of that and watching out for our patients and our communities and that kind of a thing. So I really do appreciate that.
Sure.
And again, thanks for being here and thanks for sharing with us all this information. I think that that is something that, again, most folks don't think about, that they should feel empowered to be able to have those conversations with their healthcare providers when they're in the hospital. So we do appreciate that. I've learned a lot today. So thanks so much.
Thank you for having me.
So we really do appreciate you all being here, and again, thanks Sue for enlightening our viewers. That's terrific. Up next, you're going to hear about superbugs and antibiotic resistance. Stay with us. Welcome back. I'd now like to welcome Christy Fuller, Mountain Pacific Quality Health State Director for Montana. Christy, thanks for being here.
You're welcome. Thank you.
You're welcome. So I'm really excited to talk to you today because, you know, we've been using antibiotics and antimicrobials. They've been around for over 70 years. And we all know they've been effective in reducing illness and disease and complications related to that. But I think a lot of people don't know is that right now we're seeing a real serious nationwide problem. And that is with respect to antibiotics, these very same things that are keeping us safe. So can you talk to us a little bit about what antibiotic resistance is, please?
Sure. Well, you know, we have been using antibiotics so often and so widely that some bacteria are adapting. And what that means is the antibiotics are not killing the bacteria. So we have created these, what are sometimes called superbugs, and millions of people are getting infected with superbugs every year. And in fact, thousands of people are dying from these infections.
That's scary, and I think a lot of people are not aware of that.
Right.
So that's concerning for sure. Is there anything that people who are watching can do to help fight the antibiotic resistance problem? I mean, what can we do, you know, as lay folks?
Yeah, absolutely. Well, the best defense is to try not to get sick. And you can do this by practicing healthy habits, which is washing your hands regularly to kill germs, and by staying up to date on immunizations and vaccinations. And I think most people know that vaccinations control infectious diseases such as polio, diphtheria, whooping cough, measles, and the flu. And if a person does end up getting sick, I would just say please don't insist on an antibiotic from your provider, because Antibiotics are not always the answer. They do not work on viral infections such as a cold or the flu. So if a person does get sick with a viral infection such as a cold, there are many over-the-counter medicines that are very effective in relieving symptoms.
That's great information, and I think a lot of folks don't realize that, and they can always even ask their pharmacist if there might be something that can help them over the counter. Again, to reiterate, don't insist on getting an antibiotic for the common cold.
Exactly.
And one thing we haven't talked about yet that I think is really important too is, and I'll back up a little bit, but what are we doing to fight these superbugs and to battle this that's going on? I mean, what's happening in the community?
Yeah, that's a good question. Well, to a certain extent, antibiotic resistance occurs as part of the normal process as bacteria evolve. So we will always need new antibiotics. But overuse of antibiotics is a big reason that we are seeing so many superbugs. But the good news is there is a lot that can be done to slow antibiotic resistance. Congress has approved millions of dollars to fund the Center for Disease Control in an initiative to combat antibiotic resistance. The money is going to be used towards tracking the superbugs so that we can address them sooner, to fund research to find new antibiotics, to educate providers on appropriate antibiotic prescribing practices, and to educate patients, again, in the fact that antibiotics do not cure everything, such as viruses like the cold and the flu.
Absolutely.
Yep.
So is Mountain Pacific doing some work related to this project?
Yes, so Mountain Pacific is working with hospitals and doctors' offices and nursing homes to set up what are called antibiotic stewardship programs. And these programs focus on protecting patients from drug-resistant infections and following the Center for Disease Control guidelines to help providers wisely prescribe antibiotics.
That's good. Now, is that just in Montana or in other states, or where are we doing this work?
Well, for our company, we're doing it in Alaska, Hawaii, Wyoming, and of course Montana, but there are initiatives across our country that are also working on the same thing.
That's really good information. So I think that the information you've provided is stuff that we normally don't think about, and the average person who goes to the doctor isn't going to think about necessarily. So if you could really reiterate one last thing: you go to your doctor, you have a cold, what would you tell a patient? Basically.
Yeah, I would just a lot of doctors are just encouraging watchful waiting. If a person has a cold, and we're trying to get doctors to be able to talk to their patients, saying that this antibiotic won't cure a cold, it won't cure the flu, and just trying to educate patients as well, and just helping patients understand that there's a lot of over-the-counter medicines that will help relieve the symptoms that they're seeking relief from.
That's good information. And I think another thing that, and you probably can reiterate this, that sometimes people don't think about, but let's say your doctor does indeed feel it's important to prescribe an antibiotic for you. It's really important to finish that antibiotic out if you start taking it, because again, isn't that another way that bugs can become resistant?
Absolutely, yes. Very important to finish the antibiotics just as they have been prescribed. Absolutely.
Thank you. That's just great information. Well, we're just about out of time, so I do want to thank you so much for being here, Christy. It's been a pleasure, and I do appreciate all the work that you and your team at Mountain Pacific is doing to help reduce, the overuse of antibiotics and all those complications that can come from that. So with that, again, thank you.
Right, you're welcome.
I really just want to say that, next you'll hear from Alicia Cole, a patient who went into the hospital for a simple procedure. 7 years and several $1 million later, Alicia Cole emerged a leading advocate for patient engagement and patient involvement. Her story is up next. We'll be right back.
Hi, I'm Alicia Cole. I'm an actress. I live in Los Angeles, California, and I've been an actress, been in the Screen Actors Guild for 19 years. In 2006, I found out that I had fibroids. So I thought, okay, well, if I get these fibroids taken out in August, I'll be healed, I'll be ready for the start of the television season. I was supposed to be in the hospital 2 days in and out. I had the surgery, but I never got better. It just spiraled from there. My breathing started becoming very labored, and my heart rate just went crazy. My abdomen was flaming red, and it was hard like cement, and it was on fire. My mother saw a black dot, like you took a Sharpie marker and just gently went like that. It took the doctor about an hour and a half to get back to the hospital. And he said, oh my, okay, now we need to be concerned. The black dot was like the size of a quarter. It looked like my skin had melted. He looks at my mother and he says, Mrs. Cole, are you squeamish? And my mother said, no. And he said, good, because I need you. I was terrified. To ask my mother to assist him and not wait and take me back to the operating room in a sterile, clean environment, to take a tray with gauze and put it in the windowsill overnight, and then take that same tray, lay it across my legs, and start pulling gauze out of an already open box. And they basically use their hands to pull open my incision. I've never felt that kind of pain, ever in my life, ever. The infection was spreading about an inch every hour on the surface, so even more underneath. So the infectious disease specialist should have been there that night, but she didn't come until the next afternoon. No one really paid attention to the signs and symptoms that I had. In that hospital, starting from the top down, there was a lack of consideration for the patient. It wasn't until after that, a few days, that the doctors verbally told my parents what I had. Sepsis, Pseudomonas, VRE, MRSA, and necrotizing fasciitis, flesh-eating disease. It was an indication of a total system breakdown. I was in a prominent, beautiful facility. I did my homework. I did what an engaged patient is supposed to do. I was proactive. But my 2-day hospital stay for routine fibroid surgery went from 2 days to 2 months in the hospital, a month in ICU, 9 blood transfusions, 6 additional surgeries, almost having my left leg amputated. I had a year and about 2 months of twice-a-day home health care nurses. I had an open abdomen for 3 years that would drain. Physical therapy off and on for at least 4 years. Doctor's appointments every week for the last 7 years. And over $2 million in medical bills. I used to have a lot of faith in the system. When I see what's happening in healthcare and people who it's just a job and coming to take care of a woman who's missing her abdomen, and I don't bother to read her chart before I get there. Or I don't bother to wash my hands. That kind of thing hits me at my core because it's not how I was raised or who I am. We believe in honor and loyalty and truth and standing for something, no matter what the cost. My life is completely different. It's I was a cheerleader, volleyball, basketball, softball, ran track, bowling, you name it. So that's real hard. I had the most amazing support system going through this. It's what saved me, literally what saved me. There are so many patients who are by themselves, and that's why it's so important to me to speak out, to advocate, to give back. And I'm very, very proud to have been a part of the 2 laws for public reporting of hospital-acquired infection rates in the state of California. Our hospitals are scary places. Our healthcare system is broken, but there is hope. And that hope is patience, patient engagement, patient involvement. Albert Einstein says, you cannot fix a problem with the same mindset that created it. Patients bring a fresh perspective. We are the secret weapon, the magic bullet. Patience will change healthcare.
This is an incredible example of systems gone wrong and why we need to be patient advocates for ourselves and our loved ones. I want to thank Alicia Cole and the Patient Safety Movement Foundation for allowing us to share her story. The Patient Safety Movement Foundation's goal is to get 0 preventable deaths by 2020. Visit their site to hear more patient stories or to see how you can get involved. I want to thank today's guests and to remind you at home to stay fit, stay well, and stay healthy for life with Healthy Living for Life. See you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.